This information is for educational purposes only and is not a substitute for professional medical advice. Please consult a healthcare provider for personalized guidance.
Imagine this, a condition so stealthy that it can develop without you even noticing. It hides in plain sight, quietly progressing, often misdiagnosed, and sometimes not even noticed until it's too late. We're talking about a rare, but deadly, form of cancer that begins in one of the most sensitive areas of the body, the vulva. Vulvar mucosal melanoma is not something you hear about every day, yet its impact can be devastating. Today, we are breaking the silence and shedding light on this under-discussed topic that affects women around the world. Understanding vulvar mucosal melanoma, the silent predator. You might be familiar with melanoma as a skin cancer caused by too much sun exposure. But what if we told you it could also strike where the sun doesn't shine? Vulvar mucosal melanoma is a rare type of cancer that begins in the mucous membranes of the vulva, the external part of the female genitalia. It's like a thief in the night, silently invading areas like the clitoris or inner lips, labia, without causing obvious symptoms in the early stages. Symptoms: the quiet whispers of warning. Cancer doesn't always shout, sometimes it whispers. For those with vulvar mucosal melanoma, the signs can be subtle, so subtle that they are easy to overlook. You might experience itching, unusual discharge, or unexpected vaginal bleeding. Maybe there's a small lump or sore that doesn't seem to heal. These symptoms can be mistaken for something less serious, leading to delays in diagnosis. The truth is, catching this cancer early can make a world of difference. The numbers: rare, but real. Here's a sobering fact: vulvar mucosal melanoma is rare, affecting just 0.2% of 100,000 women, according to a 2020 review. But don't let its rarity fool you. When it does occur, it's the second most common cancer to affect the vulva, with 76% of melanomas in the female genital tract starting in the vulva. It might be rare, but when it happens, it's serious. Staging the cancer: understanding the battlefield. When fighting any enemy, it's crucial to understand the battlefield. With vulvar mucosal melanoma, doctors use a staging system similar to that of skin melanoma. The American Joint Committee on Cancer, AJCC, uses the TNM system, which stands for tumor, nodes, and metastasis. It's a method that examines how far the tumor has grown, whether it has spread to nearby lymph nodes, and if it has reached other parts of the body. The earlier the stage at diagnosis, the better the chances of successful treatment. Who's at risk? The unseen factors. The question everyone wants to know: why does this happen? Unfortunately, the exact cause of vulvar mucosal melanoma remains a mystery. However, research suggests that white women between the ages of 50 and 80 are at a higher risk. A family history of melanoma can also increase the likelihood of developing this condition. It's a reminder that some factors are beyond our control, but awareness is our best defense. The diagnosis: unveiling the hidden. So, what happens if you suspect something is wrong? Diagnosis usually starts with a physical examination. If a suspicious lesion is found, the next step is a biopsy, removing a small sample for laboratory testing. If the biopsy confirms vulvar mucosal melanoma, further tests like CT or MRI scans are conducted to determine how far the cancer has spread. These steps are crucial for creating an effective treatment plan. Treatment options: the battle begins. Once the diagnosis is confirmed, the focus shifts to treatment. The primary weapon against vulvar mucosal melanoma is surgery, where surgeons aim to remove as much of the tumor as possible. In some cases, they might also remove nearby lymph nodes to prevent the cancer from spreading. But surgery isn't always enough. Depending on the situation, additional treatments like chemotherapy, radiation therapy, or immunotherapy may be necessary. Each case is unique, and doctors tailor treatment plans to the individual's needs. The survival rate: facing the odds. Let's talk about survival rates, a topic no one wants to think about, but it's important. If vulvar mucosal melanoma is caught before it spreads to the lymph nodes, the 5-year survival rate is about 65.2%. However, if the cancer has reached the lymph nodes, the survival rate drops to 26.8%. These numbers are stark reminders of the importance of early detection and treatment. Conclusion: taking action. Vulvar mucosal melanoma might be rare, but it's a force to be reckoned with. It's a reminder that cancer doesn't always present itself in obvious ways. That's why awareness, vigilance, and regular check-ups are crucial. If you or someone you know experiences symptoms like unusual bleeding, discharge, or a persistent lump, don't hesitate, seek medical advice. Early action can be life-saving. By sharing this knowledge, we hope to bring attention to this often overlooked cancer. Remember, staying informed is the first step in protecting your health. So, spread the word, ask questions, and don't be afraid to take charge of your health. The more we know, the better we can fight back against this silent predator.